Welcome, each one of you. So that would just kind of invite you all to take a few minutes to kind of tell your story around kind of how you've been connected to personally and your evolution, if you will. And Jackie, I know you the best, and kind of some of the work that you've done, and now even sitting on the board, your connection to the North Sound ACH, and what you're seeing as milestones, where you're seeing progress, and kind of what that's meant to you, and kind of where you're seeing the value add. And have each one of you do that for a few minutes, and would love to kind of loop back to kind of look a little bit to the future. So maybe Jackie, if you don't mind, I'll invite you to share a little bit around your story and where you're seeing the value add and milestones.
I love you, Monty, writing. We've been in community so long. I'm like, what happens right when we go off script? And I say, I do mind. Why do we invite Will and our other folks to join? I'm just kidding. Hi, all, welcome. I'm Jackie Julien. I am the inaugural executive director for Communities of Color Coalition. I'm going to answer your question, Monty, how I'm connected in this space. I think this is the beauty of the intersections, right? Like two things, one can exist. And so one, I serve on the board, North Sound ACH board. And then I'm also connected in this collaborative network. So, co-designing, co-creating, one sharing our experience, our wisdom, our knowledge. It's a little bit of how I'm connected, right? Those haven't always overlapped. And so navigating new territory in many ways. But I think that is also an important milestone for me to hit. Again, listening, Liz, thank you for going over, our shared beliefs, our values and principles. I think that, going back to what was shared of centering those with lived experience, coming with a lot of lived experience on the work that we do in our organization centers those that are being most harmed was lived experience. And I think to kind of build off of your question was perhaps what are some important milestones that I see in the shared work. I think some of those things, that perhaps have been mentioned, I think we're kind of honing in, and examining, as Liz shared in full transparency, this is an experiment. We collectively inherited a system that we're all grappling with in the midst of compounding traumas. And so there's a commitment to get it right, to lean in, listen, and learn and hold space and build those build systems, that aren't dependent on systems, if that makes sense. So build structures that aren't dependent on our current systems, that aren't supporting and so, I think a clear sense of how community is represented in centered and how we care for them. And this space is a milestone as we collectively are all convened in this space. We're representing, our respective organizations. But again, going back to centering those in the community, I think a milestone is an area for us to improve, is outside of having, shared definition and language of, partners of how are we intentionally centering one community, as I see a lot of organizations represented in this space. And so I'll pause there and let other folks want to join in, but yes, thank you. Space as well.
Thanks for kicking us off, Jackie. And, as somebody who has been there in many ways since the beginning and wearing different hats, so enjoyed briefly meeting you, Will. And I think you have a really different story, somebody that didn't start off as one of the original partners. And, as you said, kind of shared some lanes, but not exactly. Now they're seeing some merging together. I'll let you share that. So I'd love to just hear your story of how you're seeing the milestones in your work and world differently, in partnership with ACH.
I made the error of talking before hitting mute. Thank you very much, Monty, and it's an honor and a privilege, Liz. Thanks for bringing up my name to come and kind of talk for just a couple minutes and kind of kick off a little bit of this. Yes, as Lee was showing the history of the ACH, I think I think I was at some early WAHA meetings way back before it was the ACH. And, and I was, reflecting back of what was happening 5 years ago in Washington State, and being, a agency director of a large Medicaid behavioral health agency. 5 years ago, our world was getting turned upside down because the state was engaging in a transformation of how they purchase Medicaid services. And they were essentially privatizing the Medicaid business in Washington State. So instead of having government or quasi-governmental organizations really managing Medicaid dollars, they moved it all to managed care organizations, some of which were for-profit and are currently traded on the stock exchanges that were profit-driven. So our world was getting turned upside down, and right about that same time, WAHA was transitioning to the ACH, and there was this whole other process going on, which was really the Medicaid transformation and the development of the ACHs. And I, for one, was incredibly confused as to how these two horses got out of the barn at the same time, and were they related or not related. I mean, it was just from my vantage point, it was very confusing. And so, perfectly honestly, we're a big agency, super busy. We just kind of kept our head down and said, okay, we're just going to keep serving the people we serve and do what we do. And had, as Liz came on board, a couple of very brief introduction meetings, but really didn't do a lot with the ACH. There wasn't a whole lot of intersection. Now, fast forward probably about 3 years or so, and COVID happened. Everyone started scrambling about how are we going to serve the people that we are dedicated to serve. And I have to say the outreach from the ACH through connecting to the state around getting masks and all that stuff that was happening was just so phenomenal. Some relationships started getting built with the ACH and some shared goals. And then fast forward again to the last November, and North Whatcom County, which is where my home is, but our agency obviously is all of North Sound. A devastating flood happened in the north part of our county, and hundreds of families were displaced. And as we are apt to do as a Catholic Charities agency, with some a little bit of competency in working in disaster conditions, we were, what do we do? How can we do it? And from that, it's one of those, there's some saying, I never get things right, but born out of necessity, a child that's born out of necessity, grows strong. The relationship that got developed with the ACH around our disaster response is something I am absolutely proud of. And I think in conversations with Liz, at one point we stopped and said, this is really funny, because we tried to get together to do some things and really couldn't do it. But it was really when essentially, our wagons or our cars started driving parallel on the road that we kind of looked over and said, hey, we could do this better if we do this together. And really, I think not just Liz and I, but our agencies really started operating together in unison around some very shared goals and shared practices, like what do the people need and how can we get it there the fastest, most humane, most equitable, with honoring dignity. And we really worked together hard for, way too long. Not that it was too long, but the hardness of the work lasted way too long. And I think really landed us in a place, I feel like, of really feeling like a partner now with the North Sound ACH. That it's not, and Liz, I loved what you said, it's not about what the state was directing the ACHs to do now, it's really about what does the communities need? And that value of really trying to respond to community requests and then say, does our basket of resources and competencies match with what some of those requests are, that's how, in my mind, community development happens. And that's how correct response happens. It's really listening and then saying, do we have something that could be of value here? And I just really think that that through the last 2 years, partnering with the ACH has been one of the things I am absolutely most proud of, and part of it was because we were so in our own lane, that it really was a very easy transition. And I am one who is very optimistic about where this goes. And I think I saw a little glimmer of it. And I was trying to remember who said it, but someone said something about, so many of our structures are built up around counties or municipalities, and people don't live in counties or municipalities. They live in communities, and some communities, being one of, in Whatcom County, there's a strong between Whatcom and Skagit County. If you live in Alger, what county do you really belong to? And it's an arbitrary line. It's really about communities. And I think as we look at structures of networks that bridge governmental entities, we get to a stronger position. And I really think, and being part of an agency that does spread across so much geography, I really do see the value of entities that can help broaden the perspectives of municipalities or governments that are focused only on their boundaries. And I think the North Sound could really, I'm really optimistic that this wider view is part of the answer that does involve tribal sovereignty and does involve cities and counties that can help see past what their limitations are to what's possible. The other one thing that I just want to say before handing it off is I'm also incredibly optimistic that with the gathering of the network of partners that the ACH has really developed, so many more answers are going to come out of the stakeholders, because that's kind of what I see this as. This is stakeholders. These are community members and organizations that are invested in outcomes, and that's a very different recipe of a stew versus groups that are comprised of funders or regulators. Not that there aren't funders and regulators here, but I really get the sense that the North Sound Network is really about outcomes and community impact. And I think that in itself will help direct much more of the opportunities that come our way in being better stewards of the public and the poor's money, because that's really kind of how I see all the dollars that flow into our coffers. This isn't our money. This is the poor's money that we're here to manage and try to do something good with. So with that, I hope the optimism comes through, and just really the gratitude for our Sound ACH and Liz and her incredible staff.
Yeah. Well, thank you. And I see a lot of folks really resonating with this notion that we live in community, we live in relation with each other. This is rooted, and the values need to be rooted in, borrowed on Jackie's point, lived experience of what communities bring. We don't live in counties. We don't live in these administrative barriers or boundaries. And yeah, with Beratta, you have such rich experience in behavioral health and a lot of other areas in the state, and with the North Sound, wondering what's coming up for you and where you're seeing milestones.
Thank you. I am Beratta Gomillion. I'm Executive Director of the Center for Human Services, or CHS. We serve Snohomish County. I'm just really happy to be here today to be able to share some of our experiences, because this has been a feel-good story since the very beginning that we've been working with the ACH. We have met a lot of milestones through the direction and the help of the ACH. We were facing Medicaid transformation and really didn't know where we were going with it. And by working with the initiatives that the ACH had put out, it gave us direction. And I want to share some of those milestones with you, but the one that I am probably most proud of is the work that we did around capacity building, and particularly around our work with diversity, equity, inclusion, and belonging. Our agency went all in. That's kind of the best way I can say it. We started working with consultants, and I mean intensive work with consultants who were DEIB experts. We're still working with them. We've been doing it for 2 years now. And also we provided our leadership team, our top directors, individual coaching opportunities with DEIB experts. We were so inspired that we created a DEIB program of its own. We'd never had that before. And we hired a DEIB manager who is part of our primary leadership team. So now we've got somebody that focuses just on DEIB. It's in the forefront of everything we do. You know, it's not an afterthought. It is part of what we do now. And that feels so good. We also, you know, we adopted a land acknowledgement statement through that work. We have done a lot of different kinds of trainings with our DEIB program. It has been phenomenal. But all of our work with these initiatives, I think, has been transformative for us. Through the care coordinating initiative, we did a lot of work around acute care transitions and transitional care after incarceration. With the acute care piece of it, we started using collective medical daily. So that's part of our routine. When one of our clients is hospitalized or goes to an emergency room, we're notified and we are able to respond to that individual immediately, same day or next day. And that is just really key in behavioral health, I think, to get connected really early. And we work with the county jail to provide substance use assessments while a client's incarcerated. And if treatment is indicated, we would facilitate that transfer to either inpatient or residential treatment, or be sure that they actually made it to their first appointment with an outpatient program when released. And so the care coordination initiative was really big to our behavioral health team. And the care transformation initiative, I have to say that our substance use department jumped all over that one too. Mostly it's been around opioid and use and misuse. We now have naloxone at every location. We train all of our staff about how to use it, and we do that during our new staff orientations. And we dispense the Narcan kits to our clients and to the public. We put up posters about prevention and intervention at all of our sites. We began a regimen of postings about opioid prevention and intervention on our Facebook pages. And our director of our substance use department has conducted a number of trainings for the courts and other places on prevention, intervention, and reversal of opioids. So I'm really proud to say that we have become a leader in the opioid prevention intervention range. And we also, part of the transformation, we had to make some major changes to how we did business. We totally changed some of the things that we were doing with our intake assessment process. Now we're asking about child checks, and we're asking about immunizations and chronic health conditions. You know, all of those things, and we're asking at intake so we can make the linkages so we can treat and work with the whole person instead of just part of the person. You know, we implemented a tool that we developed so that we could address social determinants of health with every client that we have. Once if a problem area is identified. So those were pretty big to our way of doing business. And we also made a lot of progress on the strategy about implementing integrated behavioral health services in primary care settings. We now have embedded therapists in 5 different medical clinics in Snohomish County. And we were even evaluated by United Healthcare. They did a readiness evaluation for us to determine how we were doing with integration. And at their final audit with us, they put us at the highest level that they give. That's a level 6, meaning that we have full collaboration in an integrated system. And we're really, really proud of that as well. And I'll end, I could keep going forever, but I'll end by just saying how much we also appreciate the ACH for their multiple trainings. They have provided us some excellent trainings, I believe, and they've all been free of charge. You know, you can't ask for more than that. We're very grateful for their help with COVID by giving us supplies for our staff and for our clients. And we're also very appreciative of supplying us with the Narcan kits, and just the opportunity to network with other organizations has been really helpful to us. So our work, I think, has been phenomenal with the ACH, and we're excited about the future. So thank you.
Thank you, Beratta. It's really amazing to hear of all that and hearing lots of threads of kind of the change culture, how this network has influenced the change in culture and practice. I have Beverly Porter randomly, you're on my screen and I saw you clapping as you're hearing. And I just thank you, Jacque and Will and Beratta, for kicking us off. These are just 3 stories and experiences, and we wanted to give other partners a chance to kind of share. Who would be a brave soul, maybe willing to share something? And again, hoping that we have some ideas in chat. Is that Tristan?
Yeah, Tristan Kwan, with a mental health counselor with Lydia Place there. Yeah, I think, you know, this is my first meeting with the North Sound ACH, and the prevailing thing that I came away with hearing the stories from the provider partners here is how the North Sound ACH has been able to connect, especially with COVID, to connect people with the real tangible resources necessary in order to serve our client populations, but also the ways in which the guiding principles and these commitments that we are all coming here to make have really helped to energize conversations, both at an administrative level and from just sort of an everyday operating stance. And though I don't have any milestones myself, I'm excited to be getting to experience this, be a part of it.
Thanks for that, Tristan. Yeah, and welcome. Kind of reflecting that as a new member of the partnership. I saw, is it Danita who had her hand up a minute ago?
I did. Thank you. I'm Danita Price, Pioneer Human Services. This is my first opportunity to be a part of this group. Thank you very much. I'm really excited to be here. And one of the things that I'm excited about is it was actually someone else that said it. Gabriella said it's the untapped ideas that we now have a space to voice them. Whereas possibly before we have this amazing, grandiose idea, maybe a little bit in theory, which is a little bit my thing, because I kind of think in theory and how do you make it practical. But now we have a group of people that we can throw those theories out and someone can make them practical and tangible. Just like Tristan said, I love it.
Thank you so much and welcome.
Thank you.
Thanks for adding to the chat. Any other things that folks might want to give voice to? Thanks for adding some of those. Yeah, Tristan, I thought it was interesting, as we heard from the peers that some of these unexpected, really some ways tragic and traumatic events that have been experienced and spread inequitably around COVID or the flooding have actually been opportunities for the North Sound ACH to kind of exhibit values, to adapt and kind of start to learn what the value proposition could be, and kind of a new set of partners that are around the table. So it's been really interesting to see opportunities to kind of live out values in ways that were a little bit unexpected. So nice to hear that reflection. A commitment to working upstream to make a difference, also deconstructing process to find out how we can be more effective. So a lot of ideas around being more effective, being place-based, being co-located. Marilyn Scott, welcome.
Hi, Monty. I just wanted to share that in our group, we had an individual from the health department that was new to the ACH as a participant with the ACH. So I was able to share a lot of the foundational history about the ACH with the new representative that had not yet had a lot of experience with the ACH. So that kind of helped with, I didn't realize that we still have individuals that are either working at various partner agencies that have not had exposure or are not familiar with the work of the ACH. So the breakout was very good, and having a few individuals get together and just share and have the questions talking about the initiative. So thank you, Haishka.
Thank you, Marilyn. Thank you for all the comments in the chat, Xenia, for partnership and reminder around whose voices we need to be more inclusive of and centering on